Hey guys, it's HINA Chef at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as in Narberth, Pennsylvania. And we've been having our clients call in and say, hey, how is it possible that you can actually do a telehealth visit for physical therapy? Don't I actually need to come in and get soft tissue work done? Don't I need to come in for you to show me how to do my exercises or to do any of the hands-on work that you guys do? And so what I've been answering is, in the most ideal world, which obviously we are not in right now, yes, it would be great for you guys to come in and have the hands-on work if and when you feel comfortable. However, I know there are many of you who don't feel exactly comfortable right now, or you're vulnerable and not able to come in to see us. So I wanted to kind of give you an idea of what our telehealth sessions look like. Because even though you may think, like, how are you gonna work on my shoulder, my neck, my back? How are you gonna do all of that? Well, it's very possible because we can teach you a lot of stuff that you need to do at home. So I wanted to just kind of show you some of the props that we use when we've been doing our telehealth sessions, so you have a kind of a good idea as far as like, hey, what goes on in a telehealth session? So, for instance, we use, our foam rollers, we use our balls in order to do soft tissue release. We have a lot of other props, Theracanes, as well as smaller balls, bigger balls, things that we can use, even rollers that can help us do and talk you through the soft tissue work that we think that you need based on an evaluation that we do. So basically, with an evaluation, we first have to see what's going on. And so the way that we know things are tight, as well as things might not be moving well, is we can do what's called a functional evaluation, where we basically look at how your body patterns are and how you're moving just by moving your head and neck up and down, side to side, based on how you're feeling when you do that. And we can actually also visually see, kind of what's going on. So that way we can take all of our balls, foam rollers, Theracanes, things like that, and kind of tell you where to target it using these props in your own home. And that will allow you to know which muscles that you need to release, which muscles you need to work on, how often, and we kind of talk you through that. So the next part of it, typically that we start to add in, is stretching. And stretching is easy enough because with, a wall, a yoga mat, with a yoga strap, we can show you how to do various types of stretching, whether it's for your legs, whether it's for your head and neck, whether it's for your rib cage. All of you guys know that we're pretty well known of working on the spine, pelvis, as well as the pelvic floor and the hips. But what many of you don't realize is the rib cage right over here actually plays a big role into how your general body, whether it's head and neck, shoulder, or even that lower body part, how you move in and through this rib cage is actually really important. And so you need flexibility in there. So teaching you how to do specific stretches, whether it's on the yoga mat and we're doing, floor stretches, or using a yoga strap to allow you to do certain types of stretching, using things simple that you have at home, such as a door, where we can show you, how to do stretches to really open up the rib cage and which side you probably need it more for. So that's the way we can kind of navigate through. Again, and there's there's hundreds of ways we can teach you how to do stretches, but this is just a little sampling of what we do. And then of course there's strengthening. And strengthening can be, everything from using a ball, if you have one of those at home. It could just be simply being on the yoga mat and doing floor exercises. It could be using something simple as a TheraBand, and these are super easy to just buy off of online, or if you have, many of you have these things at home, simply putting a TheraBand into a door and working on, certain types of strengthening that you guys need to kind of help you when you're at home. And then even simple things like a staircase in your own home to be able to have a step to do work on. So these are just some of the things that I wanted to share with you guys as far as how we've been actually helping a lot of our telehealth patients with simple props. And some of you don't even need props because you have a lot of these things in your home. And we can, help you work on everything from head and neck, shoulder, upper back, lower back, pelvic floor, foot and ankle, right out of your own home. So hopefully that's helpful for some of you. I know many of you did have that question, how we're going to be able to do that. So I hope this video helps you understand how we can help you.